Just let me know.
Yeah, we're up. So,
Okay.
Dr. Mac, thank you for joining us.
Thank you.
It should be a very interesting conversation today. We've had a nice little chat a couple of times now about these issues, interesting things. So, um, thank you for giving up some time on the bank holiday weekend. Even I actually didn't realize it was bank holiday. Uh,
Until I told you.
no, hadn't got a clue. So yeah, thank you for joining us and taking some time out. I know you're always quite
Thank you
busy.
for invitation.
Yeah. Guys who are watching, thank you for joining us. Can you let us know if there are any sound issues? I know you always do. Hi, Hassan. So it's one of our number one fans, I think. Hassan's always here. So thank you for joining us. We thought, obviously, you're from Turkey, and there's been a lot
Yeah,
of chat recently about the whole Katie Price thing with the cut up teeth and the
exactly. Yeah.
shark teeth, whatever you want to call it. So I think you're the perfect person to speak to. And Erin last week, she said you have to get my clinical tutor on. She's got some interesting views about these things. So here we are.
Yeah. I mean, dental tourism is not something new, obviously, and it's happening everywhere around the world. It's not just Turkey. But recently, Turkey has become the hot spot because a celebrity in England posted a live video of her dental
Mm,
journey. Not to mention, actually, her dental journey started in the UK, and I'm one of the biggest critics of that type of dentistry, wherever it is around the
yeah,
world. But what actually hit me when people, professionals, started to post things like, this is what I show to my patients. If you go to Turkey to get veneers, that's how you're going to end up. Now, that's not fair.
no,
That's not how you're going to end up if you go to Turkey. Yes, there are some pop-up clinics like that doing that type of treatment because there is a demand, but there are brilliant clinicians in Turkey who could provide brilliant dentistry for you, but that's not going to happen in 2 days.
no, and that's the same everywhere.
So yeah, exactly. Yeah. I mean, there are so many well-known names, but if you ask me the most well-known name, Galip Gürel, for
Yeah,
instance, he's known worldwide. He's going to give you perfect veneers, white veneers, but they're not going to look like bathroom tiles, and then he's not going to fit them in 2 days. So it starts to become a bit unfair, like shaming the whole country. So people need to understand this is not just happening in Turkey; it's happening everywhere, including the UK.
mm,
So it's not fair, actually, just to say that this is how you're going to end up if you go to Turkey.
yeah,
Um, yeah. So if people want personal recommendations, they can text me. I know people in Turkey who could provide brilliant dentistry. Um, but yeah, people find the information on internet, and then if people like Katie Price in this example post something on social media, it becomes viral, and lots of people look up on her, and they want, oh, I want your teeth. Where did you have them done? This clinic,
yeah.
and that clinic becomes popular. That's how it works.
Yeah, I think it's almost good and bad in a way, isn't it? Because now at least there is more of a conversation because we've picked up on it. And hopefully,
Yeah,
when people go on social media, they'll see something that we've done or other dentists have done. Um, the singing dentist, there's guys like him out there who are getting out the right information. Um,
yeah,
so it does have to start from somewhere, and I think you're totally right in that, this isn't just a oh bad dentistry just happens in Turkey and nowhere else or anything like that because that's it's very disingenuous to the clinicians who are working there. You yourself graduated from Turkey,
yeah,
so we can see that just like anything, there's going to be good and bad in any sort of clinical situation or non-clinical situation wherever you are. You're not going to
exactly.
pull out, NHS MOD five to eights or 4 to 8s and say, "Oh, this is
Yeah,
British dentistry," because there are people
exactly.
doing good stuff as well. So
Yeah,
it's one of those things.
and it's okay. It's okay for people to look for cheaper dentistry. We know when it comes to private dentistry in the UK, it's an example.
Mm,
It can be expensive, but believe me, even if you go to see Galip Güler in Istanbul, it might still cost you cheaper because of the currency difference.
yeah,
So it all depends what you want. If you want to spend 10 days holiday, but you want to get your teeth sorted in 2 days, that's what you're going to get. And some of these people are happy with their teeth and they want fake teeth. They admit that.
yeah,
Um, so I'm not criticizing their choice, but the problem is the maintenance. So when they end up with a problem, who they're going to see? Are they going to go to Turkey every 6 months?
no, the likelihood is you're going to see,
And
yeah,
fortunately, on this side, we don't want to touch those teeth because we don't know what type of treatment provided. They come to see me, for instance, with chipped porcelain, and I don't want to touch it because I don't know what they used.
yeah. But that's the same
Their
with
treatment
treatment
plan.
that someone else has done here as well. You don't want to see,
Exactly. Yeah, we're very
yeah,
skeptical about like I don't want to touch this. Um, so that puts them in a very difficult situation. So they need to understand if they're happy to accept the consequences, fine. But very sad stories.
yeah. I think that's almost one of the things that people don't think about when you say, okay, I can get composite veneers for 500 and I can get everything done for 500. For example,
Yeah,
I don't know actual prices because I haven't looked into it that much detail. I know it is
yeah,
much cheaper, currency difference, regulation
yeah,
difference. Labs charge less over there for certain types of treatment as well. But it's that coming back and oh, now something's chipped. If you went to see someone like yourself or myself in the UK, and you live half an hour away, that's a much easier come and get this checked and fixed than someone who's a couple of countries away, down the other side of
exactly.
Europe.
Yeah,
So
yeah,
I think that's something that you do need to take into account. But you're right. There's people out there who haven't got £10,000 maybe to spend on treatment, and they
yeah.
don't want to
True.
spend 6 to 8 months in Invisalign, maybe 12 months in Invisalign or whatever it might be. They want something which is fast, um, and you don't you don't want to vilify these people because that's a bit it's mean,
No, it's
isn't
their
it? Yeah,
choice.
it's
Yeah,
it's your choice, but as long as you're kind of well informed upon it and understand all the ins and outs and what might happen, what might not happen, um, then it's up to you what you do with your own teeth, just as with any other sort of surgery, that you might want to
yeah,
get. But there are complications. I think that is the thing. In the UK, there is a movement towards more minimally invasive treatment,
yeah.
which has its pluses and minuses again. Um, So it's one of those. You want to do the right thing, and patients want the thing that's easiest, cheapest, fastest. But for us as dentists, we want to try and get the correct message across, and then people can make their own mind up.
Exactly. I think we should be more proactive. Like when these people Google things, that sort of thing, that information they find, but what they should find is what we're saying.
Mm,
Like I'm going to use the word like educating people, but they should find out ins and outs of this type of treatment abroad. So if they accept everything eventually, fine, it's their choice. But so many people, they don't know actually all the options. You know how they teach in dental school, like from A to Z,
yeah,
all the options you need to explain to the patient. But what they get most of the time is just one option. We're gonna like shave your teeth, put some nice veneers, but they're not aware of the other options most of the time.
yeah, yeah. I
Um,
think that's really
yeah,
key, actually, and I'm hoping that when people come onto YouTube, they'll be able to find, if they do put in dentistry in Turkey, something like this is going to come up. So I think it's really good if we just list out all the different options now. So if somebody who is a patient is thinking about doing something like this, at least before you head over there or wherever you
yeah,
go, uh, what the different options are. And there are more than one way of kind of skinning this cat. So,
exactly.
from
Yeah.
your experience, um, what would you say is the least invasive option? all the way through to the more invasive side of things.
Well, most of the cases I see in that type of clinics, Instagram pages, etc., um, the patient actually needs a little bit of tweak with Invisalign maybe or ortho, and then whitening. That's all. But what I see is veneers from 6 to 6 look like really white. Fine. I mean, patient they want white teeth,
Yeah,
straight teeth, and getting veneers is not the only way. So you should start by saying like we could do short term of ortho and then tooth whitening. You still need to give the option
yeah,
veneers, but you need to warn them that I need to shave your teeth. Uh, this is in a way that they can understand. Obviously, we're not shaving their teeth, um, but once it's done, it's irreversible. There's no going back. So you need to understand. And once the teeth go into restoration cycle, that will go on.
yeah,
These will need replacing maybe in 10 years. And when I remove them, I'm going to touch your teeth a little bit more. So every time you touch the tooth, you get closer to the nerve. So that sort of things. And actually, when you explain these things, most of them come, I don't actually want that.
yeah,
But then the financial side comes uh, in the scene. So they say that I can't really afford that type of treatment. And then when they Google, it's much cheaper in Turkey or somewhere else in the world. And I think they just accept the drill touching their teeth.
yeah,
That's all I can explain. But when if someone comes to me to say that um, I want porcelain veneers, and if I think that that will be really invasive, it's not really needed, um, I don't accept most of the time. Uh, they need to find someone else to do that treatment, and they will find someone else to do that treatment.
yeah,
So, as much as patients don't like what we're saying, we also have a right not to like what they want from us to do. Um, it's all about a conversation. That conversation need to take place in detail, and maybe not just in the surgery, because when you talk too much like treatment options with the patient, when they leave, they have this amnesia. They don't remember anything.
yeah,
Maybe to follow up in writing what you discussed with them. Um, so everything needs to be clear.
yeah. I'm fall into
It's my
in
motto.
a bit of a funny bracket because I'm not against any of the different treatments in the right situation. I think that's the key. I don't like to make a blanket statement about things because I think you've always got circumstances which a person might have. You know, if someone has had a lot of caries, for example, then we're
Yeah,
maybe not removing as much tooth tissue as previously, so something becomes a bit more viable. Or if someone's got very high aesthetic need, then you have another consideration. So it's one of those things that I don't like to make a blanket statement, but you should try
yeah,
and
no, not
do
at all.
less first. I think that's probably the way I would kind of phrase it. Because there will be people
Yeah,
who, like we say, want something which looks fake, because that's the style or the look they're after. Um, and there are ways of doing that in a less invasive manner, um, as well as
yeah.
doing full crowns. I do wonder whether Katie Price had actually had some previous treatment done. You know, someone's already taken a drill to those teeth.
So years ago, I have sometimes read those awful magazines. So she had her veneers, she called them that time in the UK.
Yeah,
And I remember she was complaining how her teeth ended up having root canal treatment after the veneer treatment. So
yeah,
it's all how it all started. Um, Funny enough, last year she went to the same clinic in Turkey to have her teeth done. So I don't know the reason why she ended up again this year. But it's not veneers anymore, it's full crowns.
yeah. These are, for anyone who's been watching. Veneers are where we either add a little bit of material if we're using composite bonding, which I'm sure most people who are researching this now have already heard of. So it's a bit of an additive material, and then you have porcelain veneers where we take the smallest amount possible away to then put a new front on, similar like you would do to a kitchen cabinet or something like that to make a different color. I think that's probably the easiest way to describe it. So you've got something
Or
covering.
artificial nails.
Yeah,
Yeah.
I need that. um, and then a crown is where we're going to cover all surfaces, so the whole way around. So obviously, if we just want to change the look on the front, then a crown isn't required. Um, and what's difficult though is every case is different, and I think this is what dentists, so speaking generally, have a difficulty kind of getting across to a patient. Just because so and so had veneers doesn't mean that
Yeah.
veneers are going to be the treatment that's good for you. We talk about something a little bit more of a technical term, but the restricted envelope, and that's the space between the teeth, the top and the bottom, when you're closing very basically,
Yeah.
and how much space we have to work in. So sometimes there isn't enough space, and we have to think of a different way of doing things. So it's not as easy as saying, "Oh, veneers, yeah, cool, I'll go get veneers," or
Isn't it a bit like the composite bonding nowadays? It's very
mm,
popular treatment option, and everybody sees on social media, so and so had composite bonding. I want to have composite bonding, and when you explain to them, actually, the lifetime is about 5 to 7 years, and it needs maintenance. It can chip, it can get stained. They're like,
yeah,
"Oh, that's not what I want." So what they
might have
hear
chipped
and
twice.
they yeah actually happens are different, and maybe they're just good with whitening or they're good with porcelain veneers.
Yeah.
So that's why you need to discuss these things with your dentist rather than making your mind up.
Yeah, and the good dentists will explain all the options, and that's kind of when you know that you're in the right place. When you have someone who says you can do nothing, you can do anything from tiny bit of addition to
Yeah,
a veneer to a crown to crown lengthening, changing the gums, all these different options, and moving teeth. Um,
exactly.
and I think again on a really technical point, the one that's really difficult to explain is yes, you maybe going to get veneers, but we're going to move all your teeth first. We take away the least amount of tissue possible.
Yeah,
I think that's something that patients really struggle with. But the offshoot of that is we have less likely um, further down the road, or less likelihood of having to need root canals because we've taken less tooth away. So
exactly. Yeah.
it's all these
Rather
things
than
which,
removing 5 millimeter, do you remove just 2 millimeter? Yeah.
yeah,
So
it's a very complicated science, and that's why cosmetic dentists, the guys who are doing stuff to a very high level, charge what they do, and are as good as they are because they're doing lots of it and not much else.
exactly, and they work with brilliant technicians, and they take up their time. So yeah, it's going to cost some
Yeah,
money, obviously.
yeah. It's all money at the end of the day, isn't it? What's the
Yeah.
situation with Turkey and kind of the costs of dentistry? Why is it so much cheaper over there?
Well, in Turkey, I let me just clarify. I came to the UK in 2005. I've been living
Yeah,
here for 15 years. So many things have changed in Turkey. The health state is different right now. So um, I don't want to give wrong information, but in Turkey, um, first of all, like anywhere else, different clinics give different prices, and some clinics do the same thing for very cheap. Some clinics do for more expensive.
yeah,
So I can't really say like how much a zirconia crown would cost actually. If anyone is watching right now, maybe they can comment on that. And also the currency difference. Like at the moment, £1 is equal to almost 10 Turkish liras.
yeah,
So yeah. So if you're doing, let's say, a crown, £500 here, maybe over there, £100. I'm not sure. I'm not sure. But if even if you compare like that, for the patient, from patient point of view, it's so much cheaper.
yeah, yeah,
So yeah, that but you can still get good quality of dentistry because of the currency difference. It depends who you're seeing over
I
there.
think that's the key. If you see someone in the UK who hasn't done many of these kinds of cases, you're going to get as poor an outcome as someone who's doing bad dentistry
Yeah,
in a different country, and vice versa. You can go to someone who's very experienced here and get a good result, or you can go to someone very experienced somewhere else and you get a good result. And the main issue I think is around recall when the patient comes back to have things checked up upon. or if
Yeah.
something goes wrong, or those kind of issues, because someone like Gulip Gurel is going to do incredible work, in Turkey, but he's still in Turkey. He's not going to come over here to come and check your
Yes.
teeth,
Yeah. No.
or wherever you are. I think that's kind of the key message, isn't it? Really, there are good dentists everywhere, and equally poor dentists, across everywhere. Um,
Yeah.
what was it like having your training done? Sorry, we're going to move off the cosmetic dentistry in Turkey talk. I think a little bit. It's kind of, we said everything you have to say there, I think. But what was your experience of dental school like in Turkey?
Well, I think I can call myself old style Turkish dentist. Well, I was graduated in 97. I'm from Izmir, a city west coast of Turkey. So I was graduated from Ege University in 97. And in 2000, between 2000 and 2005, I did my PhD
Mm,
in pediatric dentistry department, the same university. And a week after I presented my PhD, I came to UK. So at the moment, we have so many dental schools in Turkey. I don't even know the number of them. I can talk about the main dental schools in Turkey. I think the yearly intake at the moment is still like around 100
yeah,
students. Correct me if I'm wrong. Um, but if I compare to the like dental school experience in Turkey and here, I can only talk about
yeah. I
King's.
mean, they're very
I
similar
don't know
from
the
what
other
I can tell.
schools.
All the
Yes,
sleep
the
schools are very
UK.
similar.
Yeah. The main difference is in Turkey, everything is under one roof. So all the departments, the staff, students, they're all in the same building.
Yeah,
So the good thing about it is everybody knows each other. All the students from year 1 to year 5, they know each other. Staff, students know each other. If I'm the clinical tutor, I would know the whole school.
right.
Yeah. So, and the clinical experience, I have students in Turkey, they get much more clinical experience. They see a lot of patients. There is no, I don't remember a single day, even if my patient didn't turn up, I just sat there waiting. They find me a patient.
Yeah,
And you
which
see
is
like
the opposite
six to
here.
eight patients a day. So the system, the structure is different. But I can say straight away we get more experience, practical experience in Turkey.
Mm. Do you think there's do you think that's more important than having um, the technical background that maybe KCL students get? Because we have incredible kind of lecture-based learning, or
Yeah,
whatever kind of learning it is, but more of the academic side.
yeah,
But at the end of the day, these guys are all going to leave KCL, and they're
yeah.
going, or Newcastle, or wherever you go, and you're going to be dumped in an NHS practice to start with.
NHS practice.
To start with, yeah. I mean, I'll dig the knife in on the NHS system soon. I'm sure, but from a someone who's seen kind of both sides of it, I would say,
Yeah,
do you think it's a better system to have more patients through the door versus that emphasis on technical learning?
I think it can be combined very well
Yeah.
because I mean in Turkey, uh, our first 3 years we're trained like a dental technician. We do everything from scratch
Mm,
ourselves. We don't even work with a technician. We work like a technician. And we start to learn things from now year 3. In my time, it was from year 4. And lots of patients. But still, if you have a complete denture patient, you do the denture from start to finish.
yeah.
You don't send it to the technician. So in Turkey, it's a combination of both. Here, yes, the theory, the academic side is excellent. I still can't get my head around why students don't have enough practical experience, even though, for instance, King's is one of the biggest referral centers.
Mm,
So I don't know why, to be frank. Um, but it can be combined.
yeah. I
So the
mean,
theory,
the
obviously,
best
you
would
need to
always, of
know the
course, be
science behind
lots of
it.
both. The best would obviously
Yeah,
be have lots of technical teaching, and lots of academic I don't know whatever you want to call it, clinical teaching and clinical work that you're doing, and lots of academic work, the best would be to have 100% on both sides. Um,
Yeah.
but as soon as you go into practice and you've done 5 caries managements in uni, and now you've got a couple of hundred to do, in a couple of months or whatever, it's a big change. And I
I
think
think it's wrong just to rely on the foundation training year. Like yes, you're given time to see your patient for an hour or so, but I don't find it quite right. Students should get more experience, practical experience in the uni. I don't know what the solution is,
mm,
uh, but they catch up with that later.
yeah, I mean, yeah, obviously after 18 months, 2 years, you start to become more comfortable. But I don't think, for
Yeah,
people that are further on than me, people say, it takes you till 5 years out before you feel completely at home uh,
yeah,
in the surgeries. That I think that's something that really does need to be looked at, but it's going to be one of those things that um, it's nothing that I can change or you can change. It's down to
no, no.
heads of schools and those kinds of people. What was it like moving across for you? What kind of hoops did you have to jump through?
Well, obviously, when I came, I wasn't allowed to practice because I was from outside the European Union.
Mm,
It's
so
all
are we
changed
now.
now. We're outside the European Union now. But yeah, so I sit for the ORE, Overseas Registration Exam.
Yeah,
That was the year actually it was changed from IQE to ORE. So in the past, they allowed the candidates to do treatment on real life patients, but then they changed their mind saying it's not safe. So it's moved to ORE. I had to say I protested a bit for 6 months when I first came, saying
yeah,
that why do I need to prove myself? I did a PhD, blah blah. But I realized that there's no other way doing dentistry. So yeah, I started to prepare for that exam. The first step is the language test, IELTS. You need to
yeah.
pass, and once you get the grade for IELTS, then you can apply for the exam. You can submit your application to GDC. Um, I know right now it's much more difficult. They're making
Right.
it really, really difficult at this stage. At that time, it wasn't that much difficult, but obviously, no one is waiting for you with open arms. There is a waiting list. So in 2008, I passed ORI.
Yeah.
Luckily, I never failed in both sides. So the two parts of that
What
exam.
was in each part?
The first part is, yeah, basic science, basically. So like physiology, histology, embryology,
Oh
and
God.
clinical dentistry. It's all computerized,
Right.
like multiple choices, etc. The second part is the practical part, which consists of 4 stations. One is medical emergencies. The other one is treatment planning, where you talk to a patient, but the patient is an actor. So there's a scenario,
Yeah.
like models, x-rays, and you give a treatment plan
Very
to
similar to
the
finals,
patient.
then, would you say?
Exactly,
Mm.
like the BDS finals. They want you to be a safe beginner.
Yeah.
And the third one is the OSCE stations, like 20 stations, 5 minutes. And the fourth part is the practical on phantom head, usually 3 procedures. It could be just taking an impression, it could be doing root canal treatment or crown prep or amalgam filling.
Right.
And they decide whether you're good at it or not.
Mm.
I want to say something. I'm not against that exam. I think it should be done, overseas registration exam, because the idea behind it is they want to test you whether
To make
you're
sure you're up to
safe to
scratch. Yeah.
practice.
It
Yeah,
makes
in this
sense.
country. That's
Yeah.
how you do to their students. But what I protested against at that time, I didn't have to do that if I was from a European country.
Mm.
Do they know your NHS rules and regulations? No. Some of them, I work with some dentists who couldn't even speak English.
Yeah. Yeah.
Um, so that it is the wrong part.
I think for me,
It's just
part one
politics.
would knock off part one, because if you're someone who's been
It's
practicing for
very
5 years,
difficult.
and
Yeah,
you're not going to know the physiology and all that stuff you learned in first year of dental school, because why would you remember that stuff? I think what's important is to have good clinicians coming across, so they should do
yeah.
more maybe even a more extensive clinical testing situation, whether it's, maybe even they come in and, they treat patients for free for a week on a a university style clinic, and you can
Yeah,
just see what level they're at. Um, that would make more sense to me. And
I
then,
know. I mean, I think at the moment there is another exam system called LDS.
yeah,
I don't know much about that.
that's from
So,
RCS. Is it one of the Royal Colleges?
Royal College of Surgeons, yeah.
Mm,
Uh, but yeah, overseas ORE is quite stressful, quite expensive. It's not just about the money you pay for the exam. You need to go to courses. You need to buy books,
mm,
and you need to join study clubs, lectures. I was lucky enough, there was a group, they were based in Ladbroke Grove. It's called MRCF, Migrant Refugee Committee Forum. So they were providing free lectures, and they had a room where we could practice on our phantom teeth. I don't know if they still exist, but I'm really grateful to them.
yeah,
But you need to know the exam. It's not. Some people say, "Can I just still work in my country and come just for the exam?" By all means, but it's a bit like driving test. Are we driving as like we're doing in the test? No. So you need to know the exam rules, and talking to
like this.
different people from different communities, it really helps.
Yeah, because it's the same. In your driving test, I had this conversation with someone recently. So apparently, there was a clinic who's asking patients to come in, and when they have a new applicant for the job, once they get past the first stage of the interview, there's a second stage where they treat some patients. And I'm
Oh,
kind of for and against this because it's all a bit of play acting.
yeah,
If you have someone looking over your shoulder, you're going to be okay. So I'm timing 30 seconds for this bond or 40 seconds, and I'm doing all these things that it's not natural. Um, but I think you have to. Again, it's good that you have some sort of way of seeing what level someone's at. Um,
yeah,
but all these things are very. They're not a natural way of seeing it, whether someone's good or bad or otherwise.
no, no.
Um,
And also, like the examiners, there are brilliant people, dentists, who prove
mm,
themselves. They passed MJDF, they did all sorts of degrees, MSc, PhD in their own countries, but you can be quite nervous and you can say something wrong, or it could be a fussy examiner.
yeah.
So, yeah.
Yeah, I think that's kind of it. And is there anything that you would suggest people head over and look at if they're wanting to do these exams?
Well, I still get a lot of texts, mainly from Turkey. People want to practice in the UK. They ask me about how to apply,
Mm,
etc. As I said, I passed that exam like 12 years ago. I don't think so many things changed, but the best information is on General Dental Council website. That's where you get the right information.
yeah,
But what I would recommend, first of all, don't delay too much, because even passing the English test, language test, can be a bit
yeah,
difficult. And as I said, they made the application process really, really difficult. It's all like you sit in front of the computer and they say, okay, 2 p.m. You can apply. Even if you click at 2 p.m., they say, oh, it's full. I have friends here who are trying to apply for that exam. Luckily, they made their application to be able to work as a hygienist
right.
therapist. So this is something they can do while they're preparing for the exams. Um, when I was preparing for the exam, I worked in a charity shop and I worked in a restaurant. So whatever you want to do.
Yeah,
So,
the restaurant's just as stressful as dentistry, right?
but I did that to improve my English. My English wasn't good.
Right, yeah.
Uh, yeah. So, but yeah, I learned a great deal from both
What do
experiences.
you know about the specialist training? So if you've done specialist training somewhere else,
Yes.
can you, once you've passed your ORE, well done, do you then apply to be on the register, or is it more likely you're going to have to do further training?
Yes. You have to do further training.
Mm,
I did look into that. So they don't accept your speciality degree from your country. It might be different for different countries. I don't
yeah,
know. Uh, but that's why I cannot advertise myself as a specialist pediatric dentist. I can say a general dentist with a special interest in pediatric dentistry. But as long as people know you, that's what matters. But if you want to be on the specialist registration list of GDC, you need to go for further training. It's like in the UK, what you do to become a specialist. You need to apply for that position, SDR,
Either you're
and
doing,
another
you're doing the
another step. Yeah, the whole thing. Yeah, you need to do the whole thing. And I personally, I thought,
why could you be
I
bothered?
don't want to do it. Yeah,
Yeah.
that's it. I passed the exam. That's it.
Alternatively, you could probably do an MClin endo or an MClin peds or something like that, and
Yes.
then
Yeah.
apply to be on the register. But that's going to be what, 3 years at 40 grand, 50 grand.
Yes.
I'm pro.
Exactly. Yeah. As long as you have the money and time and the effort, go for it.
Yeah.
I don't have.
No, that's probably for younger clinicians who are, getting started. So maybe you did.
Thank you.
No, you've done your training. So to be honest, you should be on.
Yeah.
From my point of view, if you've done a specialist training somewhere else, the GDC should really just not being so fussy. Actually, look at the degree and say, okay,
Don't
well,
get me started on
yeah,
GDC.
there's good and bad in them. I've been to some of their meetings and things. And what was it called? The meeting I went to, workshop on uh, independent practice or something. I can't remember what it was called last year, and they paid a lot of money for us all to go down there, which was nice. And I stayed in central London on their behalf. Sorry to everyone who's paying the registration fee. I got my money back. But they are doing some good things, but at the same time, they are doing some inexplicable things as well. We want more specialists. We want
Yeah.
more highly qualified clinicians to be referring to or to, just have in the UK. So I think they should just. It's one of those things, if you've done a master's in America, and I'm sure there's plenty of guys who are masters American have done whatever specialist degree. Why should it be a big deal if that guy wants to come and work here? They're probably better than the guys who've been trained somewhere else. It's one of those things. It doesn't make sense to me.
I don't know the politics behind it, but yeah, you're right. You're absolutely right.
Yeah, that's not. I don't want to dive too much on the GDC just in case they decide to strike me off or something. So,
I'm sure they will find an excuse to do that. Not just this.
But yeah, it's one of those things. Common sense needs to prevail in these situations, and maybe one day we'll get it. Who
Yeah.
knows? I wanted to ask you as well. You're doing the King's teaching job, as
Yes.
well as having done some NHS practice, and as well as now working
Yes.
in private practice.
And private practice. Yeah.
Compare and contrast the pluses and the minuses of all these jobs, because it's something that everyone goes through. You have that nice feeling of treating the patient who can't afford high-end, private treatment.
Yeah.
But on the other hand, for me, it's stress of having a target behind me, and I don't want to deal with that because
Yes.
I don't like to be rushed. Which is why some of my podcasts last 2 hours. No half an hour quick things or sometimes, but it's one of those things. There's pluses and minuses. How did you feel about it?
When I passed my ORI exam, obviously for private dentistry, if you look at AdWords, they looking for someone with private dentistry experience in the UK, and I wasn't that person, and I wanted to get this performance number. So the way to get that number is not like doing the foundation training, like the BDS graduates. So you do the equivalence of that. But the issue is you need to find a practice who could help you to get that number. So I found the practice in Medway area, very busy NHS practice.
Yeah.
So I worked there for 2 years full time. And the first 6 months I did that. It used to be called vocational training equivalence. Basically, what you do, you submit a portfolio.
Yeah.
About NHS rules and regulations, how you apply it into your practice over there, and you get your performance number on NHS. But on my first day in that practice, because I was doing the equivalence, I was treated as a GDP, general dental practitioner. So I wasn't seeing patients for an hour or 45 minutes.
You go fast.
I remember I saw 35 patients on my first day.
Wow.
And I remember coming back home after 3 years of not doing any dentistry, just preparing for the exam, I felt horrible.
No, yeah, of
And I said
course.
to myself, what have I done today? Like in and out, in and out. I know there are different NHS practices. I'm just talking about
In
merely
general,
my
yeah.
experience here. Yes. But yeah, you can't provide good quality dentistry. It's not about you. It's not about the patient. The system does not allow you to do that.
Yeah.
So after 2 years, I moved to a private practice. But at the same time, I wanted to keep that performance number. So I applied to another NHS practice, which was less busy, but still the same type of work.
Mm.
And and after 4 years in total, I decided not to do NHS dentistry anymore. But I thoroughly enjoyed
Yeah.
doing it. Uh, as much as I lost so much money doing it, um, it's nice to help people who could not provide money for private treatment. It's nice to provide service for them, but it drains you.
Yeah, I think that's something
So
that I've really noticed. Obviously, coronavirus happened and everyone stopped. And then after about 6 weeks, you you sit back and you go, wow, I feel really relaxed. I didn't realize I wasn't relaxed before, but
yeah,
this is what I feel to be really relaxed. So,
yeah.
um,
When you're in there, you don't realize like because it's just
no,
happening very quickly. But yeah, you feel exhausted. And again, it's we all want to provide good dentistry, but the system, the overall system, just restrains
mm,
you. So it's your decision in the end. And I start to complain, like, how would you expect me to do root canal treatment in 2 half-an-hour sessions? And again, actually, one colleague told me, well, if you think that you won't be able to do a good job, then don't do it at all.
mm.
And that actually hit me in the nail. And I thought, maybe it's best not to do this
Yeah,
anymore.
someone said something interesting to me not so long ago. They said, um, or maybe it wasn't even in relation to dentistry. I think it was just in general, but I'll change it into a dental kind of setting. He said, um, dentistry or your job should be something that you're passionate about. It shouldn't be work. I think that's
Yeah,
it should be something that you get up and you go, I have no issues going in doing a 12-hour day because I'm enjoying what I'm doing or I'm relaxed about what I'm doing. But when you have a situation where there's this and this and this that you're not quite happy about, then you maybe have a problem. Um, so that's maybe what I would say to anyone who's kind of in two minds about whether they should continue. Just think about how you want to live your life, and then take that
yeah.
as the important step.
I mean, the NHS dentistry, it's all about time. Uh, you need time, but time is your limitation at the same time. So we talked about dental tourism, how to educate people, how to give different options. Well, if you're given just 10 minutes examination slot for one patient, how on earth are you going to do your examination and go through all the you accept running late for every single patient the whole day, and you're gonna accept that you're gonna go back home late,
Yeah,
and you're gonna do this every day. So it's not fair on anybody. Actually, it's not just us, but it's not fair on patients either.
yeah. I think that's the thing. And then for young dentists, you go through 5 years, maybe 6 years in some places if you've intercalated, of learning how to do everything to this incredible standard, and then 20 minutes after you come outside, you go, well, actually, you need to, someone says, actually, you can't do rubber dam for everything because, look at the clock, or look at, we have so many patients to do, and you just get told, okay, you need to cut corners essentially, and
Yeah,
that can be probably quite disheartening for people who have got a real passion for the job, and
yeah,
want to do things correctly and to the best of their standards. So um, it
and it's
might be,
very easy to get used to the bad habits.
yeah,
That
yeah.
is the danger. Yeah.
I was
So
um, I was
yeah,
listening to a podcast recently, and it was Joe Rogan, which is one of my favorites. One of the ideas I had, kind of the inspirations behind doing this podcast. I know he's very controversial, maybe, but he had something really interesting to say about habits, making habits, and the kind of people that you go around with. He goes, You cut a corner once, you'll cut it twice, you'll cut it 10 times, cut it 100 times, and then that becomes who you are.
Yeah,
So you can start off being this person with really, really good intentions. 6 months later, if you've been cutting a particular corner, you no longer have that corner, it's gone, and you're
yeah,
probably not going to get
yeah,
it back. And then what's the next thing that goes? And eventually you get to, you see these guys who've been in practice for 20, 25 years, and they look like they hate the job, and they probably do
yeah,
hate the job, but they're doing a different job to someone like, I don't know, Shiraz Khan, who's loving
yeah.
his thing, because he's doing everything to a high level, or someone like yourself who's in private practice, enjoying what you're doing. The two types of dentistry there are just like night and day.
Yeah, it's possible to enjoy NHS dentistry, but the guys, whoever is governing the NHS dentistry, they need to make some changes.
Yeah, no,
I
there's
mean,
enough ingredients
there
there.
have been talks a lot, but I don't know what's happening. Nothing's changed in
Yeah,
the last 15 years, at least I know.
yeah, there are enough ingredients there to make it enjoyable. I mean, the FD can show you that. I came out of that having really enjoyed the work that it was doing and stuff like that. But if you work at that same level, you're not going to come home with a salary, and that's the issue,
No,
isn't it? Um,
yeah.
how do you think that your students, 'cause I know you're probably in contact with quite a few who've left, how do you think they're faring
My students from
from Kings?
King's.
Yeah,
Yeah. I mean, obviously we're in touch on social
yeah,
media. So when they do their foundation training, I know they enjoy doing, and they learn new things. But I would love to know what they think once they moved from being a foundation dentist to a general dental practitioner.
mm,
It actually depends on what type of clinic they're working. If they still give in like half an hour examination slots, etc., I'm sure they will enjoy it. But if it becomes like in and out, 5 minutes, 10 minutes checkups, I'm sure they will feel the restraint.
yeah.
So I mean, young minds, it's easy to tolerate some things, but yeah. So at this stage, I know they enjoy what they're doing, but I don't know the future.
Yeah, I think that's the thing. You can get away with things when you're young. So I know there are people who doing 100 clubs when you're in uni and going and doing different activities every evening. And by fifth year, you can't do that kind of crazy lifestyle anymore. So
Yeah,
at some point, you slow down a little bit, just out of natural sort of. That's how things are. But um, I think the same thing could be said within dentistry. You can probably get away with working at a 7 or 8 thousand UDA pace for a couple of years, but at some point
yeah,
you're gonna start sleeping in all through the weekend. So
yeah. I mean, some of them ask me, like, Dr. Mack, do you think I should apply for foundation training? And I always say, yes, you need to get a taste of NHS.
mm,
And you need to get a good taste of it to begin with, where they give you time to see patients.
yeah,
So I think it's important to get that experience. And after that, and also that will give you the work experience that unfortunately we discussed that
yeah,
at dental school, they don't get that much experience. So you get that in your foundation training, and eventually you make up your own mind. But I think, I mean, if they want to jump into private dentistry straight away, there's nothing wrong with that. But I think everybody should get a taste of the
I think that would
NHS
be very
dentistry
difficult
to
to
begin
jump
with,
into private dentistry straight out of university.
unless you have really strong connections. Yeah,
Well, no, just even out of your actual skill level coming out of
yeah,
university.
yeah,
Certainly from UK university, I don't think you're quite there. My carries endpoints were all over the place. I'll freely admit that, and my ES from FD would probably say the same. He said he probably didn't really know what he was doing when he came out. Um, but after a couple of months, you learn those things. I would say after the FD year, that's kind of crunch time. Make a decision then, because if you go
yeah,
into a job where you now have lots and lots of targets, or you maybe increase your cost of living, then you have a decision to make, because you get used to
yeah,
having so many holidays, or going to restaurants or every week, and things like that. So that's the point. I would say maybe take a little bit of a a bit of a leap of faith and trust yourself, and maybe look for a private clinic, and all the way through FD, if you document everything you're doing, you'll have a nice little portfolio of work that you've done that at least you can see, and
Yeah,
then you
exactly.
can just start slow. You don't have to do all these crazy cases straight away. Just do normal dentistry that you
No,
were
no,
doing
no.
before, got on under a private system, and then go on a course here and there, and then you can slowly level up. I think that's probably a nice way to do it.
Exactly. When I speak to my students, sometimes I know they're very eager and they're all on social media seeing all these dentists posting very nice cases. They all want to be cosmetic dentists, but you need, I mean, it's a very classic phrase, but you need to learn to walk before you
Mm,
run. And they get their hands on digital scanning. But I always tell them, you need to learn how to take a good impression.
yeah,
So it's very important. You're not going to get a digital scan in your NHS practice, maybe.
no,
So you need to learn the basics and then you can add on it.
yeah, yeah,
So it's very, very important to give that message to young dentist students as well. It's okay to be ambitious. It's nice to be ambitious, and I hope they can provide all that beautiful dentistry once they graduate. But they need to learn the basics, and sometimes they're gonna learn that basics in their NHS practice.
yeah. It's not
So
impossible to do that. I think it's just be careful not to fall into those ruts we were talking about and starting to cut corners, because
yeah.
then if you're someone who cares about the work that you're doing, uh, you'll end up unhappy.
And I always tell them, like, now you have the time, you're given 1 hour to do that occlusal
Yeah,
filling on a lower six. Put your rubber down, take photos, do nice your practice time.
yeah,
So they need to make the most of it.
yeah. Any top tip that you give to a student just before we kind of wrap up a little bit there? Any top tips to the guys coming across from other countries? You find it difficult to get a job?
Well, that is the part. And even the GDC website says that passing this exam does not guarantee you a job,
Mm,
which is very true. Because there are two implications. One, private dentistry, they want private experience in the UK. NHS dentistry, they want performance number.
yeah,
And to get the performance number, you need to do that training
DTE.
and you need to find that practice. So it's not easy. So you need to be patient with that. But you need to pass that exam. So at least get that out of
Out of
your
the way.
sight. You pass the exam and then you look for a job. The difficult part is to find the first job.
Mm.
Once you get the first job, the rest will follow.
I I would
It
say it's
just
probably
needs
hard to do it in
patience.
London. I think that would probably be the worst thing for you to think, oh, I'm coming to the UK and I'm going to work in London.
Yeah, it's very competitive
Mm,
in London, so they need to maybe consider going somewhere else in the UK.
yeah.
It could be up north, down. So London is very competitive. We already have lots of graduates waiting for a position. So
Mm,
it's not going to be easy. So they need to consider other parts of the UK. And also people who have their families, they need to consider like living
cost
in
of
the
living
UK.
as
Yeah,
well. Yeah.
working here is fine, but will you be able to get used to it? If you have children, will they be okay in their school? So a lot of things to think about. But for a
Mm,
young, like new graduate student, they need to have the finances, the
yeah.
patience, and the time, because you may not be able to pass the first instance. You
Yeah.
may need to repeat that. So you need to accept all these things before you go ahead.
Yeah. I think that's there's nothing much I can add there really. I think um just think about, I think with all these things, NHS versus private, coming to the UK, not coming to the UK, um, I would always think, how do you want to live your life first,
Yeah.
outside the clinic, because a clinic's a clinic and you're going to be gone at the end of the day. And I'm sure they can replace you just like that if you decide to leave. So think about how you want to live first. That's kind of my advice, and I'm becoming very holistic in the things I'm saying now. But that's probably what I would say.
But I also say, because I lived that myself, I thought my English was okay before I came here because I was reading articles in English, etc. But daily English is completely
Different.
different.
Yeah.
So it's very stressing actually not to be able to speak properly. You
Mm.
can be very good in academic writing, in your emails, reading, but speaking is so different. So and it can actually make you depressed because you understand what the person is saying, but you can't just find the right word to answer back,
Yeah.
and you translate everything in your head. So the first thing I would say is if their English is perfect, fine. But if it's not good enough, they need to improve their English. And the only way to learn the native language is actually to live there, to live
Yeah,
amongst the
and
people, and do
speak with
other
people.
things
Yeah.
maybe. Yeah.
Yeah, I can't add anything much more really. I think that's probably the best advice for anyone coming that I can give. You've been there and done it, so um, thank you for adding all these great insights. It's been really fun talking to you. I'm sure everyone's learnt
Thank you.
quite a lot. Happy birthday for the weekend, by the way. I forgot to say that right at the
Yes.
start. Um,
Thank you.
so yeah,
I've
I'm
to enjoy.
very glad that you managed to find some time on your birthday weekend to join us. Um,
A pleasure.
to the guys who've been watching, thank you for coming on. If you've got any questions to either myself or to Dr. Mac, get in touch on Instagram or the comments down below. Make sure you like the video as well. That really helps me out. Um, and thank you for joining us. Big shout out to the sponsors of the program, the guys on the Patreon group who've been helping me out with being able to afford some more equipment and things like that. So if you want to help me out with those things and get a few perks along the way, um, have a little look at the link in the bio, and hopefully you'll join us on the little chat room we've got there. And yeah, that'll be really well appreciated. But Mac, thank you for joining us. I think this has been really fun.
Thank you.
Yeah, really
Thanks for your
great.
invitation.
Um,
I really enjoyed it.
make sure, guys, to join
Thank you.
to follow Mac on Instagram, Dr. Mac _Boule, which is your handle. I got that right, didn't I? Good.
Yes, Makbule.
Yeah. Um, so yeah, make sure you guys go and follow it, and make sure to watch out for the videos that I'm coming up this week. I'm doing the third in the series on how to grow your dental Instagram, and we've got a couple more interviews coming up or podcasts coming up soon as well. So
Wonderful.